Hello everyone, my name is Dr. Rachel and I'm so delighted to be here today to tell you about the Health Equals Freedom Making Sense of Cancer service and how that may be able to help you. So you have had a cancer diagnosis or someone in your family has, and I'm really sorry that that's happened to you. Cancer is one of the scariest words in our language. To most people, when you hear cancer, you think of death. And cancer as a disease is just everywhere right now. So many people have got a new cancer diagnosis. Now, part of the thing with this word cancer is that it actually, to our brain, causes us to feel fear. Now, when our brain feels fear, pretty much it shuts down. Anything that is said or how we feel, we sort of go numb and things just don't get into our head. Our brain stops working. Some people, when they experience fear, they actually want to run away from the situation or they do strange behaviours. But whatever your fear response is, it's totally normal and understandable given your new cancer diagnosis. Now, in this short video about us at Health Equals Freedom, I'm going to explain, I'm the founder and creator of Health Equals Freedom Making Sense of Cancer. And I'm going to explain why I did that in the first part of the video. So I'm going to explain three things: why I've created Health Equals Freedom, what services we offer you and potentially how that can help you, and three, how to access our services. So I'll keep this short and just give you an understanding of why we are doing this. So I have an unusual background myself. I have a science degree with honours in pathology. Now, pathology is the study of disease and what causes disease. And following that, I got first class honours and I went on to do a PhD in medicine. And I studied, again, disease, and I studied both at the University of Sydney and Stanford University in the US. And when I graduated, I started working on treatments for disease, such as cancer, and I have done a whole series of things, including I've been a trainer, a teacher, a coach, I've lectured at universities, I've worked in hospitals, I have worked in disability services as well. So I'm very, very medically literate, and as a navigator, so a healthcare navigator in cancer, my job is to basically help listen to what the doctors tell you during this early stage of your new diagnosis and support you so that you can pick a treatment pathway that suits you. So you can actually make good decisions for yourself, which actually empower you and also give you the best chance of a good outcome from your cancer diagnosis from that point on. So I'd graduated with my doctorate, and as so many people have, a family member, an important family member was diagnosed with cancer. So for me, 16 years ago, this happened. And my younger cousin, first cancer diagnosis was a thyroid tumor, which is in the neck. So he had treatment for that. And he was married with a 1-year-old baby at the time. And just 3 months later, he actually had another diagnosis. And that was of a brain tumor, a really, really big one. So about the size of an orange above his ear. So the diagnosis was, it's really big, we can't cut it out. And that's called a resection in the cancer jargon, medical jargon. So we couldn't cut it out. That was the diagnosis. Prognosis was 3 months. He was 27. And I said, look, that's not good enough. Let's get a second opinion. And so that's what I helped to facilitate. So we got a surgeon who could do the surgery, very talented surgeon, and he actually removed my cousin's tumour after a 7-hour operation. And he actually was then able to walk out of the hospital the next day. So brain surgery one day, 7 hours, walked out of the hospital next day. We were totally amazed. Fantastic result. And for 4 years, my cousin lived cancer-free. Unfortunately, at the 4-year mark, a different sort of cancer grew in the cavity related to his environmental factors. And I can talk more about how I think environment plays out in cancer if we do work together. And also I've created some content on the website as well. And anyway, so 4 surgeries after that. So he had 5 all up. Then he had radiotherapy, he had chemotherapy, and I helped facilitate experimental chemotherapy because of my medical network and knowledge about drug design and how drugs are delivered to patients. Got him some experimental therapy, and he lived ultimately 9 years. And it was a really complex, difficult journey, but I learned so much from that. And certainly, it set me up on this healthcare navigation pathway, and that's why I've set up Health Equals Freedom. After that, about a month later, my dad did the bowel screen because he got the little kit in the mail that people get in Australia when you turn over 50. And he did it, which I was surprised at because my dad is not very proactive with his health. And they found a big bowel cancer. So my dad had surgery and chemotherapy, and I'm glad to report he's more than 5 years cancer-free, which is fantastic. And then late last year, my mother got picked up on breast screen with breast cancer. And so I've managed to navigate her through surgery, chemotherapy and radiotherapy. So she's really going well too. Lots of my friends have had cancer. So hairdressers, colleagues, friends everywhere, cancer. So I have, in the experience of working in the system and understanding the system, I can see that there's a really big need for people, no matter where they are in Australia, no matter what their background, having someone who's medically expert sit with them in, so physically, sometimes I'll do that, but primarily someone who's going to listen. So most of the time, so that I can actually, and my business can service the whole of Australia, I'll dial into calls with your GP, specialist, whoever you need me to be with you at the appointments, and listen to what the doctors are telling you. Make notes, audio record it, which is my preference, because we can then go back through that, and actually we can through video coaching go through all this complex stuff that they tell you when you're in shock and you can't hear, and help you understand and unpack what that is, and so empower you to make good decisions about your health, your body, what you want to do, because that's what you should be doing with your cancer treatment pathway journey. Okay, so that's why I set up Health Equals Freedom. So second thing is service. Now I've explained a little bit, I've touched on some of the things that we do, but I want to just also talk you through a few more aspects of that in terms of what services that we can offer you. So in terms of the actual pathway, we take a very evidence-based approach for your cancer type, your age, your circumstances. What is the best evidence-based approach to go through in terms of your treatment pathway? Now, your doctors will guide you on this, but there's always alternatives in cancer treatment. You can do things in different order. So you may want to do a particular type of treatment. So you might want to do surgery second, for example. The old pathway or old evidence-based approach was to do surgery first, for example. Depends if you've got solid tumor. If you've got a blood cancer, it's slightly different. All these things need to be personalized for you, and you need to understand why things are important in terms of the treatment pathway. And sometimes you actually need to carefully consider the sequence of treatment, because that can actually change your outcome. So you need to understand that. we can actually help explain and coach regarding these treatment options and pathways. We will attend medical appointments Australia-wide, so via the telephone and also secure telehealth video. Now that COVID and the pandemic is still going, but people are much more familiar with telehealth, which telehealth is not Skype or Zoom. It's actually a secure video where we can discuss information, exchange sensitive and personal medical information securely so that you can actually make better decisions. We can also offer medical literature searches as well as clinical trial access if that's appropriate for your cancer type and stage. And the estimated cost for the majority of people, which is scary, I know, for cancer treatment costs, most people sit out of pocket about $30,000. So if you set up your treatment pathway correctly, we can actually help you save money. We offer case management of logistics. Now, one of the things that often doesn't happen is the whole cancer journey is not coordinated. So your surgeon's just worried about your surgery, radio oncologist about radiation, GP often doesn't know what the specialists are doing. So as your navigator, we help you organise all the different pieces to actually make it more seamless and less stressful for you and your family, which is really, really valuable. We can often also recommend getting a second or third or fourth opinion if needed in your case. Not to say that's necessarily the case, but like I shared with my cousin, it was certainly the case because the first opinion was, sorry, go off and die. So, you know, in some cases, second opinions are very important. And because of the way we do provide this service, we aim to improve your health outcomes, provide you support emotionally, and particularly that's really important in the new diagnosis stage of cancer. And this, if we get engaged early, that is going to set you up for a better treatment outcome. Now, I need to explain two things we don't do. We do not provide medical advice. That's what your healthcare professionals do. And we do not recommend particular treatments. Again, that's for your health professionals to recommend and you to decide. It's not for them to tell you, it's for you to decide what is the best treatment for you. Okay, so that's the second part of the video, which is our service. And in this About Us, I promised I would tell you how you get access to us. So one of the things I offer to anyone is a 15-minute free consultation. And that's to work out if you want to work with me and if I can work with you. So that's for anyone at all. And also, in terms of getting access to us, you can, on the website, we have a contact or inquiry form, so you can contact us that way. We have a 1-800 number called iSense, so making sense, 1-800-iSense, yeah? And we also, you can email me or email us on admin@health=freedom.com. If you're a healthcare professional, so you could be a GP, social worker, case manager, specialist, you can actually make referrals to our service. You might be an insurance provider. You can make referrals to our service on the health professionals tab, and we have a referral link as well. So hopefully I've given you an overview of what we do and why. So thanks for your attention and time, and I hope that's of great value.